This portion of New Day Northwest is sponsored by the Larrabee Center for Facial Plastic Surgery.
Deciding to undergo plastic surgery can be a big step, and there are many things to consider. Today we're talking with two plastic surgeons from the Larrabee Center about cutting-edge procedure called Vaser Lipo that is less painful, faster in recovery, and has better precision. They are the only Seattle practice currently offering this procedure by board-certified plastic surgeons. So please welcome the founder of Larrabee Center, Dr. Wayne Larrabee, and plastic surgeon, Dr. Gregory Park. How are you guys?
Very good.
Thanks for having us. Welcome back.
Oh, thank you, Margaret.
And so we really appreciate you bringing Dr. Park, who is a specialist in this brand new thing. So let's talk about it.
Exactly. Well, it's good to be back, and it's good to introduce Dr. Park. Dr. Park, our dream has been to have a comprehensive center where we can do not just faces, but all parts of the body, and he comes to us with general, wonderful plastic surgery training, but also real expertise in body contour surgery and breast surgery and so forth. So, and he's brought us some wonderful new technology that he's going to talk about us today.
So what is this machine we have a humming here?
So this system is called the Vaser Liposuction system, and how it differs from traditional liposuction, it uses a more gentle process to extract fat from unwanted areas of the body. Traditional liposuction uses forceful suction as well as hollow cannulas to essentially rip fat out of the body. It's a traumatic way of removing fat and cause some bleeding, and the recovery is relatively prolonged. Now the Vaser is a much more gentle process. There's various steps that we use. The first step is to place tumescent fluid, and what that is a physiologic fluid that has some numbing medication as well as some epinephrine that also helps to minimize bleeding. After the tumescent solution is placed, we use the Vaser cannula, or the Vaser probe, which is a solid probe, and what that does is it delivers high-frequency ultrasound.
We're looking at an animation of it right now.
Right. So the first step is the placement of the tumescent fluid. The next step, as you see here, is the placement of the Vaser probe. And what the Vaser probe is doing is using that tumescent fluid to essentially break up the fat and separate it from the body's connective tissue.
I can see what's happening. So you're not only breaking up the fat, but you're kind of removing those little fibers that hold the skin together.
It doesn't actually remove the fibers. It leaves those fibers intact.
Those fibers are there?
Right.
Okay.
So traditional liposuction does injure those fibers, and that's why it takes longer to heal.
Oh, I get it. Okay, and so now we're looking at an animation of a kind of a before and after. Tell us what that's all about. Can you see it?
Right. So this animation just essentially shows different areas of the body that can be treated, and men and women can be treated with liposuction. Men tend to have problems in their abdomen. Women tend to have problems in the hip and thigh areas.
But you can use this on all those various areas. Here's a before and after. Tell us what happened in this particular case.
So in this patient, she had difficulty losing some extra inches in her back. She was very athletic, but she needed a little extra help. So that's where liposuction comes in.
Well, and you're not suggesting that we do this instead of getting in shape. We're talking about those pockets of fat that remain there no matter what you do, and we all know where those are on our individual bodies.
And the patients are close to their ideal body weight. They're exercising on a regular basis. They're eating a healthy diet, but they still have some frustration in losing those extra inches.
Right, and a lot of that is just genetics, correct?
It is, right. So this is another fairly athletic patient who had 2 babies and is having some difficulty losing the fat in her abdomen. So the Vaser is a nice way to remove that extra fat, and the recovery is much faster.
So what kind of recovery? A few days?
A few days.
Okay.
So, for example, if you have a relatively sedentary job, you can have Vaser liposuction on a Friday and potentially be back to work by Monday or Tuesday.
That is amazing. This is really interesting to me because this is another genetic reality. Sometimes you just have this business going on under your chin that you don't like, and look at the results on that.
This is Marilyn, our patient.
And Marilyn's actually here. We're going to talk to her in just a second. But before we do that, apparently, I'm not a doctor, but I get to play one on TV. This machine that's been going on, this is the little gizmo. That's probably not what you call it?
It's the Vaser probe. And this is the thing that really sets the system apart from traditional liposuction. So what you're going to do is place the probe in the water And we're going to show how you can break up fat very effectively using the probe. So I'm going to go ahead and turn on the system.
Okay.
You can move it around.
I can just kind of slice through this butter and get rid of it. Wow, I get it. That's amazing. Oh, I wish that were happening on my hips right now instead of just in the butter. That would be so cool. I get it. All right, that is amazing. Yeah. Marilyn, you're here to say this worked for you, right? Sort of, you did head to toe kinds of procedures. What did you have done?
I had liposuction done on my neck, my belly, and my back. As is evident, you know, I am a menopausal woman. And not only do you deal with hot flashes and sleepless nights, but there are the muffin tops and the residual pouches of fat. And I'd said enough. I have a healthy diet. I exercise, scheduled a consult with Dr. Park, came in, he explained the procedure thoroughly to me, went into the office, hour-and-a-half procedure, went home, took it easy, you know, for about 5-7 days around in there, wore a compressive girdle. Then after that, back to work, and it's just gotten progressively better and better for me.
And how do you feel about this?
I feel great. I knew that I was not going to get anywhere with just continuing with diet and exercise. In order for me to really get rid of this, I had to have a procedure done, and I would do it again in a heartbeat.
Well, you look fantastic,
well,
and I'm glad you feel good too. Thank you all very much. I mean, this is a real step forward because, as you mentioned, the old-time procedure was apparently weeks and weeks of recovery and a great deal of bruising, and this is a whole new world. Thank you, guys. If you're interested in getting a complimentary consultation with the Larrabee Center, please just visit our website, and we will link you right over. Thank you, Marilyn.